awarded a diploma at the advanced level. He is a lecturer also in the Master of Aesthetics program at the University of Frankfurt, and he's a full member of the British Academy of Aesthetic Dentistry, and he has special interests in implant dentistry and digital smile design. So, you know, he's someone who thinks like I do, and has certainly lectured, as I said, internationally, and certainly on all aspects of implant dentistry, which is one of his strengths. His lecture tonight, bringing the team together, which fits beautifully into the Stronger Together theme that we thought of. And in fact, you know, I think the appropriateness of Stronger Together, and we obviously came up with this before the pandemic arrived on our doorsteps earlier in the year. But I think it really fits together because, you know, in order for our practices to stay open, to thrive, we've really all needed to be responsible in making sure that it's a safe environment for all of us and all of our patients. And I think that, again, I have to stand and say thank you so much to SADA at the beginning of the year for taking on that responsibility that they did so amazingly in putting together teams and writing and getting out the protocols that gave us the confidence, you know, that we could go out there and see patients in a safe, controlled environment. And I think that also gave our patients really an amazing feeling of security. And I think, you know, that as a profession, you know, at this stage in the year, obviously, you know, when it was March, April, we all thought that this was the end of dentistry. But I think, you know, looking back on it, we've come out really well. We're well placed. And I think that, you know, going into 2021, I think that we're going to be stronger and better together. So if there's any questions, if anyone would like to ask me any personal questions, we have another 2 or 3 or 5 minutes when Martin will be joining us. So, you know, if you want to go and get a drink, get something to eat for the next 2 minutes, now's the time. And as I say, once he's got his internet connection stable, he really had a problem with getting a stable, you know, some internet issues. We will be starting this lecture sharp in about 2 or 3 minutes, we hope. But if there's any changes, I will bring you up to speed. So let me just yeah, give you any update I can. 1 second. There we go. The good news is that he's logging in and he has an internet connection, so we are going to get this lecture underway. And again, so sorry for the delay, but I can promise you that a little wait and minor inconvenience will definitely be worth your while. Right, hi, Martin. Martin, can you hear me? I think you need to unmute. Can you unmute yourself? Martin? Martin, can you hear me? Yeah, there we go.
Clearly.
We got you. All right. Thank you so much for sorting that out. As we're a little bit late, I have introduced you.
Okay. All right.
I did. You weren't here to hear my amazing introduction.
Oh,
you have to trust me that it, but you have to trust me on this one that it was great.
Oh,
we have some time afterwards. I'll tell you all the brilliant things I talked about you and what you've achieved in your practice and your career. So I think as everyone's been waiting, they know all about you, and I think we should jump straight into your lecture if that's okay.
That's absolutely fine. I'm just sharing my desktop now, and you should be able to see my desktop. Just checking.
We got it. We got it.
I'm just checking you've got visual now. Is that all okay, Mark?
Beautiful.
Okay. First of all, I'd like to give a huge apology to Mark, first of all, and to all of you for keeping you waiting this evening. This is completely not normal. I like to pride myself on timekeeping, and today I'm sorry that I've been late to meet you here. Hopefully I'll make up with it with what I've got to show you and with the time we've got left. It's a real privilege having met Mark, and you'll see the picture later as to where we met. In person and online, being invited to talk to all of you today about something which I think is really important and poignant at the moment during COVID times, which is bringing our teams together. I show this picture. I'm sure all of you know what's underneath there, and the picture underneath there, and this really typifies, I think, what a team can achieve. And what I want to do today is talk about the different teams that I'm a part of. And with the teams that I'm a part of, and how what we do together as a team is worth more than the sum of our parts. Mark's giving you an intro, so I'm going to skip this bit. You know that I practice in London. What you might not know is I'm from Uganda, and that's where I grew up. I've still got a lot of family there and friends there. And this is where our practices are in Clapham and in Balham. I'll skip the introduction bit because Mark has gone through that. And really, what I'm going to get to really is the crux of the lecture. I've obviously got to make sure I thank my family, who you can see here, and I'm going to talk a little bit about our team. What you can see on the screen is just a small part of our team. My partner Nick Sisodia and I are based over 3 practices in Clapham, Balham and Wandsworth in London. And this is the team on a day that a photographer came in Clapham. And you can see we're quite a varied team, quite a multiracial team. We all come from different parts of the world, and we pride ourselves on the number of languages that are spoken in the practice, and the fact that actually on any given day, if we have someone who comes in speaking a new language, hopefully someone can communicate with them. We have been beaten on that challenge a few times, just so you're aware. And I think, as with any teams, we've been through some highs. And you know, some of the highs that we'll remember is back in 2017, when we won best practice in the UK for referrals, as well as for general dentistry. And that was an amazing thing that we, as a team, achieved. And that, I think, is one of the high points of our team. Another high point for me personally was one of my patients who unprompted, decided to talk about me she was a journalist, to talk about me to her newspaper and describe the journey she went through and having her upper and lower full arch prosthesis that was carried out at the practice. And that again was a huge high. There have been some lows, and I think there have been some lows, if we're honest, recently. And I think one of the lows for me has been this year, has been seeing your team like this, over Zoom, having your team meeting, wondering if you're ever going to be open again, and the uncertainty that this caused. So I think with every team, you go through times where there's highs and there's lows and there's difficult times and there's easier times. And I think as a team, you have to really try and stick together during those and see what you can do. What I'm going to talk a little bit about is I'm going to talk about what we achieve as a team, and really what this comes down to is our main focus. Our main focus are our patients. And if you look on our website, there's something that says a patient. These are all patients of ours, by the way. These patients have all been very happy with treatment. And when they've been happy with treatment, they've been very happy to give testimonials on video and allow us to use their photographs in their marketing. And again, we talk about our patients being at the heart of what we do. What I'm going to do now is just play a short video that comes next, talking about what we do as a team.
The quality of the work that I received, I would say, was amazing.
Yeah, the care I received from 10 Dental was 10 out of 10, to be honest. Contactable all every day of the week.
Probably among the best I've ever had. I certainly do get the sense that they are giving you the benefit of everything, the wisdom that they've had over the years of experience.
Yeah, it's just easy from beginning to end. There's always someone to let you know what's going to happen. You've got the care there to just call up and somebody will help you out if you've got any questions.
I really felt that MIDI wanted me to have great teeth.
Annika was my orthodontist.
It was Martin, was my dentist.
It was Palm.
I had my treatment with Ilios in the Clapham branch of 10 Dental.
One of the things about 10 Dental I love is that they showed you what could be a likely outcome, and they were not unrealistic.
Martin spends a lot of time explaining the procedures with photographs and pictures. I understood exactly what he was going to do and what the outcome would be.
Like everybody, we're all time pressured these days, and they're always very accommodating, and they make you feel really comfortable.
I'm just going to stop the video there because I think you get the gist of it. Really what it shows is how we as a team work together. And you notice the part where they talked about the different people they'd seen at the practice. That's important to us as a practice because we work as a team together, and we work as a team to achieve outcomes for our patients. Now, obviously, when you look at this graphic, you think about the practice and we look at our practice. And when we look at the different elements that make up our practice, we obviously start with the patient. And within the patient, we realize that when a patient comes to us, there's going to be a referring dentist. The referring dentist is part of our team. The receptionist who answers the phone is part of our team. The dentist who does the treatment, again, that's part of our team. The nurse who helps us do the treatment, as well as the treatment coordinator who forms part of it. It even goes as far as sometimes we have a sedation team to help with the care. We've also got a dental laboratory that's part of our team. And all of, combined with a dental hygienist, all of these go towards treating a patient in a simple way. We're also very fortunate that we have a referral practice. So we have referring dentists who refer endodontics, periodontics, orthodontics, oral surgery. All of these different specialities can be worked with as we, as a team, form part of the narrative and form part of what we obviously talk to our patients about. So my part in here, I'm the grey one that you see on the side. I'm the implantologist. That's what I do. And that's how I form part of the team. Now, when I started looking at this, and when Mark asked me to give this lecture, as part of what he asked me to do, I thought about how our practice fits in. And when you look at the dental ecosystem, one of the things that you think about is you think of you and your practice, and you may think of a few things around you, such as your laboratory. You may think about education. You may also think about the suppliers who supply you with the things that you need to work every day. We've also got in the UK, we've got our regulator, which I'm only going to mention once, and I'm going to leave in place just there. But really, these all form part of an ecosystem. What we know is the laboratory has their own ecosystem, and we know that the regulator has their own ecosystem with lawyers, etc. We also know that the dental manufacturers have their own ecosystems with research, dental reps, people carrying out repair and maintenance. We also know that within education, there's dental associations such as the South Africa Dental Association. There's teaching hospitals, private courses, as well as people doing research that again leads to education. And there's also the fact that there's a financial element to this. When we start to join all of these things together, what we realize is we form part of a web. We form part of our web that's a dental ecosystem, and that part of a web is where we, as a clinical team, start to fit together. So I've talked in general a little bit about the practice. I've talked a little bit about the dental ecosystem. I've talked a little bit about, again, where we fit in. If we look at what we're able to do clinically, one of the things that I think is really, really interesting is how we work with our team.
Hello, my name's Hannah. I'm one of the treatment coordinators here at Dental. Former dental nurse, I'm lucky enough to have a wide range of knowledge when it comes to dental treatments. My role as a treatment coordinator is to guide our patients through their patient journey for the duration of their treatment. Whether it's orthodontic or implant or cosmetic dentistry, I'm here to ensure our patients have the best experience possible. As part of my role, I also help our patients navigate our payment options so an informed decision can be made. If you have any questions, please don't hesitate to contact me, as I'll be more than happy to assist you.
The other thing that we like to do is we like to empower our team. And as part of empowering our team, we use digital technology, which I'm going to show you in the cases that are coming a little bit further down the line. And we let our nurses do the scanning quite a lot of the time. And so
by us undertaking the scans here at Dental, it allows the clinicians to get on more with the technical planning. It also allows us to understand the procedure a lot more effectively and the patient to understand what the outcome.
So it seems a little bit strange that the most expensive bit of equipment we have in the practice we hand over to our nurses, but by empowering them to do that, it frees us up as clinicians to spend time preparing notes, preparing treatment plans, thinking through the case before presenting to the patient, and also having that scan ready on the screen to show the patient at the time they book, at the time they have their consultation, is really, really useful. I'm now going to show some cases, some of the work that we do as the practice, and this should hopefully show a team approach to how we approach dentistry. And again, along the theme of bringing the team together, I'm going to talk to you about this man, our man. Now, he's come in and he wants to do something about his teeth. And he's come in and he's initially seen one of our orthodontic team. They've assessed him, they've looked at a lateral calf. As well as looking at lateral calf, they've decided on what procedures they're going to carry out. And when you look a little bit closer, I mean, as well as seeing the fact that he's slightly class 3, the other thing that becomes immediately obvious on looking closely, and these photos are from our orthodontist, Dr. Ekta Grammatopoulos, his central's missing, his upper left central's missing. His lateral has been made into his central. And in talking to him about the different treatment options, he also has a cross bite and a slight open bite on both sides. We've talked to him about carrying out a comprehensive treatment, which involves a long period of orthodontics, and on explaining the benefits to the patient using the technology we've got. He's been happy to embark on this, and the treatment has involved taking his upper central tooth, taking the lateral that's a central, trimming it, stripping away the composite, moving the teeth around in order to create space. Once we've created the space, what we've then done is we've put a pontic in place to maintain the space and to give me, the implantologist, an idea of the space that's there. And we see him progressing through the orthodontics until this is the moment when I inherit him. And this is the time when I take him over from the orthodontist. At this point in time, the lateral's been trimmed down to nearly the correct size, not quite the correct size. It needs to be a little bit slimmer. We've got correct spacing in and around the arch. He's got some sort of bite. And at this point in time, I've sent him to finish up with the orthodontist. These are his photos. I wouldn't normally use alternate impressions when he's got braces. I've got a scanner that would work much better for that. And this is the point where I meet him. And when I meet him, everything's been set up for me very nicely by a member of our team, by our orthodontist. He's left me all the spaces in the right places, which means that when I begin my part of the treatment and begin the assessment to place his implant, everything is in the right place for me just to go ahead and just place an implant into the space that's missing. And this is an example by how working with teamwork and using the orthodontist for what they're good at, what we're able to do is to take this patient, carry out his CT scan. On his CT scan, we can see we've got a slight deficiency of tissue in place. We can place the implant using some expansion techniques, but again, we're going to have a little bit, we won't have enough soft tissue in the area. So as part of the implant placement, the brackets have come off, the wires have come off, the brackets remain, and we've carried on and obviously made our osteotomy. Having made our osteotomy, what we've been able to do is place our implant using some ridge expansion in this case. As well as that, we've also carried out a rotated pedicle graft to build up the soft tissue in this area. And once we've built up the soft tissue in this area, what it's allowed us to do is in one stage, take him from where he was and start the process of restoring his implant. This has been a delayed implant placement. This is him after about 2 weeks of healing. This is at the review. This is when he's having, the space was maintained with the orthodontist. He kept the tooth out for a couple of weeks just because we could maintain the volume that was there. And from this part, it really becomes a straightforward provisional restoration that you see here. And from the provisional restoration, we've looked at the shade and the shape, made any adjustments to the contact areas, adjusted that lateral where you see the slightly square shape around the mesial part of it, and taken a shade. What you can see us using here for the shade taking is the eLab system, where I take this photo alongside a polarizer, which comes, standard set for your cameras. And with this, what we've been able to do is, again, just a little bit of finalization before we get to the point where we deliver his final crown. So this then becomes the easy part, putting this crown in place. And what you can see here, it's the crown we've made. This is a zirconia crown. We've used a custom abutment in this case, a custom abutment and screw retained crown. This has popped right into there nice and easily, but you can see how by having a team approach to this, using the orthodontist for their skills, using the technician for their skills, we've been able to actually give him an acceptable result. The shade's a little bit light, if I'm honest, but he's very, very happy with the final result, to the point where when I asked him to come back after some whitening, he still hasn't been back. But again, being able to work as a team approach to treat cases like this, and also to get outcomes where we've got the soft tissue coming out of, a good soft tissue profile on this final result, has really allowed us to change this man's life. And what's quite nice with this is when you look at him smiling at the beginning, and when you try and get someone to smile at the beginning and they will grimace, they'll wrench, they won't move their lips and teeth correctly. This is really what we do the work for, is to be able to deliver this so that actually we have a healthy, confident smile of this patient at the end that looks natural to him. So that's a case where we've worked alongside with our orthodontist as well as our dental technician. And the next case I'm going to show is one where, again, it's in the theme of working alongside a team. This is one where I'm an implant surgeon. I place implants all day, every day, but there's certain times when you have to call in someone who has a set of skills within implantology that maybe are more suited to a case. And this is the case with our next case. And with our next case, along the theme of bringing our team together, she came in with a deranged dentition and really quite a difficult and complex case. It required a maxillofacial surgeon, getting obviously a sedationist, working with 2 technicians to get to the point where we could deliver that. And you'll see within the video that we show the process that we went through to deliver that. And the reason why I like it is I like the effect it's had on her and actually how we've been able to work with her to deliver that. So this is our start point. We can see we've got a real lack of bone. We've got a lack of vertical dimension. She's very nervous. This is our digital wax up that we've done, using again from the intraoral scan. And what we've been able to do is to merge the intraoral scan and the CT scan to get an idea of the fact there is no bone really in the maxilla, even in those anterior areas. So we're going to need to place zygomatic implants. And this is Guy McClellan, a very talented implant surgeon who travels in and around the UK, who's carried out this surgery. And what you're seeing here is him going through the process of placing 2 zygomatic implants. This was a quad zygoma case in the end, just on the top left-hand side. And all the steps and stages that he's gone through. The gentleman at Southern Implants will be very pleased because this is one of their SADA implants that he's placing today, in this case. What I really liked about, and the reason why I showed you that particular surgery, the patient came back swollen, bruised, sore, but in amongst that, she found time to send an email. And the email she sent, I'm not going to make you read through this in detail, but it mentions each and every one of our team, from the person who booked the appointment, to the nurse who was working on the day, to the sedationist, to the oral surgeon, to the dental technician, to me who was the restoring dentist on that day. And it's really this sentence that I think really, really typifies and sums that up, which is this part, which is just saying that actually individually and collectively, that really is what a team is about. You work as individuals, but then collectively, you're all able to do much more than you could as individuals. I'm going to now talk again about another part of, an important part of the team who I work with, which is the dental laboratory team. In the UK at the moment, a lot of dental laboratories are struggling who work within the NHS because a lot of NHS dental practices are not doing work. So really it's a thought spared for all the dental technicians who are currently, you know, sat there waiting, wondering when their usual flow of income is going to come in. And really, at the moment, I'm very lucky to work alongside this gentleman you see here. This is Jamie Brain. This is our CDT who does the immediate loads and also does our overdentures, works within the practice. There's also some people I work with outside, and that person on the left, Steve Campbell, is someone who I work really, really closely with. And we talk and travel and lecture together. And really, I'm just going to typify what I think is, when we talk about the team approach to this, I'm going to show you a case that we did. And within this case, it just shows the amount of work your technician can do to make you look good and to actually help you with a complex case. This is Elaine who's come in. And Elaine's complaint is, oh, she knows she's going to lose all of her top teeth, but she wants a nicer smile as part of this. Her main priority is not the surgery. Her main priority is, what are the teeth going to look like? Are you going to satisfy my demands so that when I walk out of here at the end of my day, my teeth are going to look nice? And as part of the process we go through taking extraoral photos, intraoral photos, and we carry out a process of smile design, which I'm sure Mark and Howie and those of you who know DSD are very well versed with. I use a slightly different system, which you'll see in a second. But the process is always to present our technician and our technical team with as much information so that when they embark on this reconstruction, they allow us to actually do our work, and they allow us to make her, if you look at her smile on the right-hand side, look good. So this is her intraoral scan that we've taken, and from the intraoral scan, what we've been able to do is to design her smile. This is software you can see that allows us to do that, or you can see her pre-op on the left, you can see her proposed on the right, in the middle you can see me using the slider just to see what the teeth are going to look like, and I show this to her and say, look, are you happy with this? At this point in time, she says, yep, I'm fairly happy with this. I'm happy for you to go ahead. And that's been done as an external center. So at the time this has been done, this is not my usual lab technicians. Again, this is another part of my team. They're based in Timisoara. It's called SmileCloud. And using this software, we're able to mock up or prepare a version of what her teeth are going to look like. With this version of her teeth, we still need to ensure that we're going to be beyond her smile line. And as part of this, what we do is we get her to smile. And this is an important part, which is showing these videos to our team. So when we get her to smile normally, that's how much she can move her lips. When we get her to grimace and see how much she can move her lips, you can see actually we could have a problem here with the transition line, i.e. with the pink and white meat on her final prosthesis. Without looking at this closely, getting everything prepared, without showing this information to our technical team, it's very hard to skip through the next steps and stages. We're then able to use this, and this is really where Steve steps in. We get the wax up, we get her smile as it is, and we begin the process of preparing. And we're able to look at the layers of digital information that we prepare, and you can see that's her as she currently is, and you're going to see us remove that. And from there, we're able to digitally remove the teeth and start to have a look at what's going on inside the mouth. And once I'm able to look at this and able to talk to Steve and able to tell him what I'm going to do and where the teeth are going to go and the position and shape of the teeth, we're able to do a lot in terms of preparing the patient for surgery. I'm just going to skip to the end. So really with this, we're able to see where we want the teeth to be using this design software. This is done in Exocad. And it means that when I talk to Steve, I say, look, Steve, this is going to be slightly complex. We're going to need not just a guide, because we need some of those teeth to support a pilot guide or a preparation guide. So I can tell him in this detail that actually keep some of these teeth for the first guide. This is where I'm going to place some of the implants, then take some of the other teeth out, then give me a second guide to go with. And then also within this, this is how much I'm going to need to shift the transition line in this case. And from this information, we talk via using a software called Dental Share, where things go to and fro and to and fro. And using, again, this is the plan. Again, I'm not planning on doing this fully guided. It's just pilot guided. But with that, what we're able to do is I'm able to send him the implant positions, and then he designs me a series of steps a series of guides, so that when it comes to actually doing the surgery, I go from the first to the second to the third, and each time there's a knowledge or an instruction as to what's happening next, in order that we can actually put everything in the right place. So I maintain the correct prosthetic position, as well as maintain the correct prosthetic position, ensure that actually the implants are in the correct position and bone removal and reduction is done in the right way. So this is what I get back from him, and you can see how he's able to set me up with layers of information, guides, preparation that allow me at the time of surgery to look at exactly, to know exactly what's going on, exactly where implants are going, exactly where reduction is going to be needed, so that we're planning our surgery to that extent. And once we've done this planning and prepared where the implants will go, the position of everything, then the next step really is, I think, incredibly clever by him, because what I get then is I get a series of steps that allow me to go through this. So within this, you can see that's a pre-op position with the CT scan in place. And you're going to see the next part come up. This is the first guide we're going to use. This first guide is going to use the teeth we're not going to extract. So we're going to extract some of the teeth and place this first guide. And also, and then go through the process. So really what I get back is a series of steps. And this again, which, you know, when we talk about bringing the team together, it's when you get something like this back from your dental technician that takes you from the first step, you can see on the right-hand side of your screen with the gray model, that's to get the guide pins in place. The second guide you see on the next part of the screen is to, once those teeth have been extracted, that's where those are the positions of the first implants. The third in the middle that you see, well, that's the position of the rest of the implants that can't be shown with the first guide. Then what you can see in terms of the blue, as well as the yellow, those are guides for positioning the temporary teeth, so that when we position the temporary teeth, everything is referenced back to that original scan. Everything is referenced back to that original wax up. And I don't design guides. I don't spend hours printing. I don't have a 3D printer, but my technician does. And when he does, he can make my life a lot easier by helping me prepare for surgery in a way that allows me to go through all of these steps at the time of surgery, so that when it comes to doing the surgery, when I meet the patient on the day, I know that the first step is to place the first guide, put some guide pins in, to remove some teeth, to place the second guide, to place some implants or carry out some pilot holes. And from there, once we've placed some pilot holes, to place some of the implants in place. And then at this point in time, I'm actually working with a different team member, who's Jamie. You saw he's our CDT. What he's able to do now is he's able to use this we use this thing called intraoral welding. So you can see there's a metal wire in place. The metal wire is made on the implants and is welded on the implants, so that actually the implants are rigid and stiff, and we get rigid and stiff provisional restoration. And you can see here how the wire fits into the restoration. And we pick this up on the day of surgery, so that what we deliver in the end to the patient is something like this. And the important thing at the end of this is we've carried out all this technical work. We've kind of prepared, you know, we've done all this preparation, we've done all this thinking, but the person who it matters to, the patient, all she wants to know is, what does this look like? And that's really where the working as a team, being able to communicate with one another through digital channels, being able to share as much information as possible, understanding how we all work together as a team, has been able to deliver that. And within that, we mustn't forget that there are a huge number of support staff that are part of our team that we bring together on a regular basis. So that's where she's gone from there to there. That is really, I haven't shown you the bone, but that's really a complex case in terms of the location of how much bone she has. She's got an existing implant that we've left buried. You know, we've got differing gingival heights, but we've been able to just level that all out and give her something so that when she looks and she smiles in the mirror, everything looks nice as far as she's concerned. And that really is the proof for her when she looks at this part here. Just, this is how she looks a week or two after surgery. And that's her smile with the midline. The cant is corrected. Bite's fine. So within that, that's really the benefit of working with the team. Now, the third part of the team, or the third team that I thought about when Mark asked me to do this, was the education team. And that's a moment in education that's at IDS 2019. And that's with the Digital Dentistry Society, of which those are all prominent members and presidents of different organizations. And that's one of the times when we could meet and travel, etc. But I think, when we talk about the education team, that's again something I'm passionate about, because I think one of the reason why education is important is if you think about how, and this is something from Frank Spear, how education works within your practice and works in some ways to improve your bottom line revenue, if you want to say it in another way. And it works because I saw this and I thought it was really, really a very nice way to summarize the importance of education to all of us and the educational team. The first thing is, on a daily basis, when you bill a patient, you can only collect what's in your diary, the money that you bill out. The second part is you can only book into your diary, you can only produce what's in your appointment book. So you can only bill the patient that's in front of you. You can only bill what's in your appointment book. So how do you change your appointment book? You change your appointment book because actually you can only book in treatments to your appointment book that your patients accept. So only once they say, yes, I'm going to have that, full mouth of implants, I'm going to have that crown, I'm going to have, that mouth of veneers, I'm going to have that digital dentistry. Only once they accept that can they book into your diary. How do you get your patients to accept that? You get your patients to accept it by presenting them different options and showing them different options and showing them things that they could have that you're aware of. That's how you get them to accept that, by talking to them and by having that conversation with them. So how do you present different things to your patients? You present different things by being able to treatment plan. And by being able to treatment plan, that involves diagnosing, treatment planning, and then communicating that treatment plan. That's the only way you can present it, by showing them what's possible, showing them videos, photos, x-rays of what you've done in the past, and the screen in front of you, and talking about it in a knowledgeable way. And really the treatment planning element of it is where the education comes in. Because really, if you can't see it, you can't treat it. That's really you can't treat it. So the whole system of how you get to do more of what you like comes again from education. So really, education is key. Events like this, which are, this is the EAO, this is 2019. These, hopefully there'll be something like this in 2021. This is the other place where I spend a lot of time, which is at the Royal College of Surgeons. I'm a tutor alongside these fine gentlemen on the diploma in implant dentistry. And this is some of my current cohort who I'm working alongside. I teach and train. That's a suturing exercise you see there. But really, this is what education has been for all of us for a while. It's this view here. Again, just, webinars and speaking in that way. The disadvantage of this has been, the fact there's no face-to-face contact. The advantage has been, I think, the sheer volume during lockdown, when we had, lockdown in March this year, the sheer volume of different lectures that you're able to give and you're able to receive. And what we're seeing happen within education is a slight change in emphasis. We're seeing more events like this. An event like this is what you would call a hybrid event. So that's Steve Campbell, and that's me, and I'm in London. Steve's in Scotland. We're actually talking to people who are in Norway, and the people in Norway have some people in the actual venue. They also have some people who are watching it remotely. And what was quite nice about this event is we had a video camera on the different areas where people were. So we could see that people were there, people were active, people were engaging. The questions that came through were really, really, shows that there was a lot of engagement. So within all of this, it was a huge benefit having access to education in that way. So I think really this is how education is going to be for a little while. And this is how, we're going to need to travel and for a little while, certainly while the pandemic is there. So really in conclusion, I'd say that what we've discovered as a team is that we are more than the sum of our parts. And that part, I think, has come through in terms of the treatments we offer patients, the ways in which we work together as a team, the different teams that I'm a part of. I'm very grateful to the lab team. I'm very grateful to the education team in terms of their support. And really, again, my absolute sincere apologies for being late for you. I know it's late there, so I'm not going to keep you longer, but my absolute sincere apologies for being late to Mark and the rest of you at the South Africa Dental Association. And really, thank you for your time this evening.
Thank you, Martin. If you stop sharing your screen, we'll answer some of the questions that are there. Thanks so much for that. I think it's a super important topic. And I think that, you know, one of the things that I found during lockdown is that we were bombarded with a lot of clinical type educational programs, and we lost our way a little bit with, you know, the types of programs that I think were probably more important for us as clinical owners or clinical participants, which is how to structure a better environment that we can come back and work in a stronger way, you know, and provide treatment for our patients in a much better, precise way and more predictable way. And so we focused a little bit on that, on this kind of team building program, which was quite interesting. And that really helped us in our practice. And one of the things that we've introduced, and I'd like you to just give a little bit more of your opinion on that, and there are some questions we'll get to, was, in my opinion, the importance, and we could never do without this, of that person that you named, and that's what we call is a treatment coordinator, which really is someone that handles the journey of the patient, you know, rather than what used to happen, in my opinion, is we used to have our surgeries and our reception, and then there was this big void where patients just got lost in the process.
Yeah, I mean, absolutely crucial. We've worked with treatment coordinators probably for about the last, I'd say 8 or 9 years. It absolutely transformed our practice. It transformed the types of treatments we did. It transformed, because when you have a patient who's considering a really, really life-changing and potentially expensive treatment, they want one-to-one contact. There's a point in time where they're considering, is this right for me? Am I going to go ahead? What you know, what are the benefits of this? There's so many non-clinical questions they have, and having someone handle that journey is absolutely crucial. So yeah, at all of our practices, we have a treatment coordinator. It really would be something which, if you don't have and you want to do more complex work, I don't think you can work without that person. I remember when we first started, the thing that happened is that the first lady we employed, we were very nervous about it, because we thought, hang on, that's another wage, it's more money, you know, why are we going to employ this person? We said to her, listen, you have to cover your wages in the first month. In about 2 weeks, she had more than covered her wages, and she went on, and that was her worst month ever. Just the way in which she was able to engage with patients, talk to them, explain things which they don't want to ask me in the surgery. They don't want to ask me stuff. They want to ask her. When it comes down to, again, talking about finances, how can we pay? How can we spread out payment? Are there different options? Absolutely crucial. Absolutely crucial. I'd 100% agree with you that that's transformative.
Yeah, it's been a game changer for us to have that middle person who handles, you know, what the gap, as I say, I call it, between the surgery and the reception, because our nurses used to have to try and kind of take that role, but in all honesty, it took their focus off what they were there for, which was to, again, help the patient in the surgery. And so that's something that I would really encourage, you know, any practice owner to just, and they can certainly message me. I'm sure Martin will be happy just to start to get that person who coordinates treatment. It's not a receptionist, and it's not a nurse, and it's not a dentist. And the other thing that
Mark, if I can add, I think one of the things that we found is we found having a little room, a separate room for them, was crucial. So not to sit them at the desk, not to sit them in the surgery, having an office for them, because in that office, when the door's shut, is when patients open up and have their own conversations with them. So that's one of the things I'd say we found, is making sure they have their own space to work in, not at the desk or in the surgery.
Yeah, that's 100%. So let's go through some of the questions. It said, are your team members, orthodontists, surgeons, lab technicians, all located on the same premises?
We have orthodontists who work within the practice. We have a clinical dental technician who comes in and he does, so clinical dental technician produces dentures as well as makes our immediate loads for full arches. So he comes in for those days. We have orthodontist, periodontist, oral surgeon, children's dentist. We have all of those in-house. They don't work every day. They all work part-time at our practice. But the lab, we don't have in-house. We don't have enough room. And I think we don't really have, it would be one of the ways in which I think technology has really, really helped us is we don't have an in-house lab, but by using technology, you know, we use an intraoral scanner, we use lots of photographs, we exchange documents through WhatsApp, through Slack. That effectively makes it like having someone upstairs if you use all the technology available to you. So that's the reason why, you know, I think our investment in technology has been crucial for that communication between the dentist and the lab.
No, I totally agree with you. And in fact, that goes on to the next question. And I do a presentation about intraoral scanning, actually, and then the uses of an intraoral scanner. And one of the biggest uses, you know, and everyone thinks that an intraoral scanner is just something that takes impressions, or it's an alternative to taking an analog impression. But 100%, you know, an intraoral scanner is way more than something that just takes impressions. And you alluded to the fact that it's one of the best ways of communicating, you know, dental problems with a patient. And so one of the questions was, what intraoral scanner do you use in your practice?
In the practice, the main one you saw was I've got a Trios. I've got a Prime Scan, and we've also got a Trios. So we've got two. And we will be buying a third because they get heavy use on some days. And I think what's been very interesting is, I'd say if you're thinking about buying a scanner, you won't regret it, but you have to use it, and you've got to go through the initial pain, you know, the initial learning curve of this doesn't work, how do I do this, which button do I press? But once you get through that, after, let's call it a month or so, you really, really won't go back. So hence me pointing out on some of the slides from our orthodontist, I'm saying I would never actually take an impression when someone's got braces with Alginet, because you could scan them and have the braces digitally removed. There's so many things you can do once you start investigating it that you'll find many, many uses for your scanner.
Yeah, it's a record of the patient, you know, in terms of it's our responsibility to understand what's happening in a patient's mouth. And the best way, you know, to understand that patient's sort of oral health issues or their stability or lack of stability is with a scan, because, you know, with a scan, you can go back with another scan a year, 5 years later, and then have an absolute understanding of what is going on in that person's mouth. You know, are their teeth moving? Have they got gingival recession? Are their teeth wearing down? And it's the first time that we've been able to do that, for sure. So scanning is definitely something that we all need to add to our practices. We have a 3-shape, by the way. Yeah. So the next question from is anonymous that said, you have invested a lot financially and otherwise. Of course, we invest, you know, this is our lives, our practices. In your practice that have become part of your lifestyle. Is the prospect of retirement a consideration, or is that not a priority in your life? The question is especially pertinent considering, and you'll like this part, that you look very young and that you're reaching the 90s.
I've deliberately left my grey beard on today. It's funny, I still really enjoy what I do. I still go in, I still get very excited, I still enjoy learning things. So when you talk about retirement, it's not, you know, I don't want to stop. I'm still really enjoying it. So while I was still enjoying it, I will still do it. The investment I consider worthwhile because I think I've been very fortunate because we've effectively, me and my partner have built 3 buildings that have become dental practices. And with each one, we've made different mistakes. And the one that we've built now has lots of things that I'd always wanted in it. So it feels like I've got the place to work in with all the things that I want to work in, that there's not really much more that I want other than just really to, you know, have lots of good patients and to work alongside lots of good referring dentists and team members to produce dentistry. Hopefully some travel and some lecturing, but, you know, the main thing it really is the work that you do on a daily basis.
Yeah. I mean, I'll probably answer this a little bit better because I'm older than you. And, I'll be honest that in my career, I've never felt more excited about being a dentist and about my prospects of being a dentist than ever before. And I think it's because of the ability to do what we do and what we love doing best, which is helping patients and changing lives. And we have the tools today, to help us to do the job in just a much more efficient, much better way. And I think the communication tools that we have with our patients, allow, and with our team, by the way, allow us to communicate with patients so that our patients understand treatment. I think one of the biggest problems in the past was that our inability to explain to patients about the treatment that they needed. And if people don't understand the treatment, you can't understand, you must understand that they're not going to accept to go ahead with it. And there was a statistic that something like, and this was amazing from our DSD world, that 62% of diagnosed dentistry gets left untreated.
That's massive. Yeah.
And that's, I think, a lack of our ability to communicate to our patients, in my opinion.
I would agree with you, because I think of, we've always used cameras to try and explain to patients, but before we used cameras, or whenever we have a new dentist that starts and they go, oh, I don't really need to take photos of the patient, we say, no, you do. No, I don't. I can just explain it to them. And I said, look, the patient is buying depending on how enthusiastic you are. When you say that, they're looking at you for other signs of, okay, does this guy think it's really serious? Does he look really enthusiastic? Does he think it's going to be a good thing? This guy or girl think it's going to be a good thing. And based on that is how they make their decision. Whereas with a photograph, which is what we used to use a lot more, but now we use intraoral scanners, being able to blow that up to the size of the screen and say that's the problem there. It then becomes, you're kind of co-diagnosing alongside the patient, which is the process that we enjoy in the practice. But like you say, I think in terms of tools, in terms of availability, and in terms of tools that we're able to use, and also in terms of, I think patient awareness has changed, certainly in terms of what we're able to do, the fact we're able to do, move their teeth, give them new teeth with veneers, remove all their teeth and replace them with implants. They're aware of these processes. So that makes it a lot easier in terms of communicating, and also it makes it a much nicer time to be a dentist.
So I agree with you. So the next question is from Norman Clement. He said, is implantology and aesthetic dentistry a separate speciality in England? We had this question in yesterday's lecture, as one cannot call themselves something within a discipline that is not recognized as a speciality in dentistry, according to, and here we have the HPCSA, which is our governing body. So what they're saying is can you call yourself an implant specialist, because there isn't such a thing as speciality in implant dentistry? Or do you have to say that you run a practice limited to implantology?
There's no such thing. We don't have a specialism in implantology here. We don't have a specialism in aesthetic dentistry. What you can say is, you can say limited to implantology. You can say implantologist, but you have to be clear that that's not a speciality. That doesn't mean you have any additional qualifications. You can talk about your qualifications that you have to do that. But in essence, no, there's not a speciality. And I think where in the UK there's been an issue with this is because it crosses so many bounds. Is it oral surgery? Is it prosthodontics? Is it periodontics in terms of your suturing and your suture techniques? Is it aesthetic dentistry? So because it crosses so many boundaries, we've been unable to agree, or our governing body called the General Dental Council have looked at this a few times, and both times the reviews have come out and said, no, we're not going to make it a speciality. Do I think, does it matter? I think in some ways it's useful for you to be confident by the learning you've done and the training you've done that you're providing this to a high standard. And I think that's really the most you can do. And that's the important thing for me, certainly. But no, it's not a specialty.
Yeah, I agree. I mean, I think the quality of your education will allow you to determine and understand the complexities of cases that you're able to take on. So the better educated you are, the less likely you are to take on cases that you can't do, is what I would say.
And also, I think the other thing is I showed you a case which was, I don't place zygomatic implants, but we have someone who does. You know, when there's something that is beyond my competence or someone is much better at it, I will definitely, you know, you'll refer that to someone who can do a better job than you for that. So I think that's the other part of it, is understanding the limit of where you can get to.
Yeah. So the next questions were, and I think it's it's probably the most important thing that we've talked about, I think, because it's something that changed my life in my practice, and we run a very, very busy practice, was the introduction of treatment coordinators. And I think that it's a role that most practices at this point don't have, and that I think that they should be looking to get. So we should probably put all the questions together because they're kind of similar. So I'll read the questions and we'll answer them at the end, or you can answer them. So first of all, excellent presentation. That was a statement, not a question. What kind of qualification does a dental coordinator have? Or what kind of background do they have? And I'm sure you've got an opinion in that. I also have an understanding. Is the treatment coordinator a lay person or someone trained in dentistry? Is the person legally allowed to give dental professional advice in terms of ethical rules and regulations of the HPCSA? Another question from Helena Vogel. What education would you want this treatment coordinator have? So they're all kind of similar. The next one, you mentioned a treatment coordinator. What qualification would you regard best suited for this position besides clinical experience? What qualification does the clinical coordinator hold? What registration will they hold within our HPCSA? So in other words, with the GDC, do they need, because I take it your dental nurses need to be registered with the GDC, is that right?
Absolutely.
So that's the same in South Africa. Our HPCSA they have to have the registration. And so, yeah, so what I think they're looking at is, you know, if we put all those questions together, is who's that best person to train to become a treatment coordinator?
So I'll start with, you know, the best person the best people we've found are people who have been dental nurses, because they understand dentistry. That's the first thing. And they understand the subtleties and intricacies of dentistry. So the people who we have traditionally used for this role have been dental nurses, who've qualified as dental nurses, who have experience as a dental nurse. So they understand what goes on in the surgery. The other part that we add to that is they have to be the sort of person who's a people person, who likes talking to people, who likes spending, you know, if you've got a nurse who's just really chatty, the one who can explain stuff to patients, who's always chatting around, that's your ideal start for a treatment coordinator. We do keep them registered as dental nurses because of some of the functions they carry out, and that we find useful, and also we like them to keep up their registration. But beyond being a good dental nurse with really good people skills, the other parts can be taught. The parts where a lot of what they deal with are questions about treatment, where I might spend half an hour explaining the process of an immediate implant to a patient. They'll go to the treatment coordinator next door and they'll say, what is he going to do? Is he going to put it in on the same day? I will explain it in my way, but they will explain it in a different way. And when the patient's under less pressure, i.e. they don't feel silly asking the question in front of me, they're more than happy to ask it of the treatment coordinator. Are they registered to, you know, are they registered to give advice? I think we urge our treatment coordinators to give very general advice. So they cannot specifically diagnose or treatment plan. That is made really clear. So if someone comes in, whatever they think of the case, they cannot diagnose. What they can say is they can give them an idea of different treatments that may be suitable, as well as the cost of those treatments for which they may be suitable. At the end of this, the patient has to go and see a dentist, has to have a full clinical examination, has to have radiographs taken. They have to go through this usual process. But really, for a lot of patients, they're not sure, you know, how much something costs, and they just want to find out. So once they get an idea of cost, they generally understand that the cost will be within a certain price range, and they'll go to your dentist to find out. I think I've answered that. So do they have a specific treatment coordinator qualification? No, but there's lots of courses, and there's some online. There's someone who runs a very successful course. She's called Laura Horton. She runs HORTON. She runs a very successful, and I think it's now online, treatment coordinator course. And also the lady we work with in Poland, she runs one who, you know, in and around Poland. But it really, really will transform your practice if you want to do more high-end work and more complex interdisciplinary work. It's the ideal person to allow you to do that from lots of perspectives. I hope I've answered that about the ideal person in terms of being a dental nurse. Their personality, I think, is quite important as well. Mark, what's your take on it?
Yeah, I agree with you. So our dental coordinators, I think, the problem in a dental practice is that we always have to, I think, provide an environment for growth of individuals, and I think I'm not today, some of our girls and guys who are nurses absolutely love nursing, and that's all they want to do for the rest of their lives, which is great. But there are those individuals who obviously, they want to go beyond dental nursing, and previously I think that channel went towards reception or practice manageress. But really, the reception is the reception, and they are really people's people that are kind of first point of call. They have to be, they're kind of representing your brand, your practice, and so that's a completely different job. They're at the first kind of area where patients will get contact with us. The coordinator is someone who has to understand dentistry. They have to understand the workflow of a case from the beginning to the end. And they will be the person that coordinates the treatment. In other words, if the patient needs to see a specialist, if the patient needs laboratory work, that the laboratory work is back. They understand about the treatment plan. They understand about the estimate. So the treatment coordinator, in my opinion, is definitely the best type of person, is someone who has a lot of dental nursing experience, and has also got organizational skills.
Yeah.
One of the things very organized.
One of the things that we found useful is also teaching our treatment coordinators to take clinical photographs. And what surprised us was some of them are better than some of the dentists who we work alongside. And really, it shows you that certain things can be taught that you assume can't. Some of our treatment coordinators with the nursing qualification can do scans as well. So within this opens up that a real possibility. They can be talking to someone about treatment, they can be taking photographs, they can be doing an intraoral scan, they can then be discussing some orthodontics. It makes a really, really quite varied and exciting day for them. But the bit which you mentioned with the organization skills, that is key, because they need to organize people like you and I who are busy, like to be doing that, but not necessarily organizing everything around it.
Yeah, I agree with you there. We had a comment now, following on the question of retirement. Many colleagues cannot wait to get out of dentistry. For me, modern dentistry has opened up a new career pathway at my age. They don't say how old they are, but they're probably my age. And I've begun the profession to love the profession even more. Yeah, I mean, I agree that I've been practicing dentistry for almost 40 years, believe it or not. Next year will be my 40th year as a dentist. And yeah, I mean, I really honestly have never felt so excited being a dentist, for sure. Tell me, Martin, it says, because you work in various countries in the European Union, has Brexit had any impact on your services? Sorry about that. Just to remind you about
it hasn't yet. But ask me on the 2nd of January. But the first thing we've noticed is the movement of people. We're getting less qualified people from Europe moving to the UK. So, I mean, the immediate thing was to make it slightly harder in terms of recruitment. That's dentists, dental nurses, dental receptionists, admin team, etc., who I mentioned in that. So that's made it a little bit harder. We won't fully know the effect of it because we've got the double whammy of Brexit and lockdown. So really, with those two things, who knows what's going to happen. But I think we will reach a balance at some point, because we will need, in the UK, that there's jobs, there's opportunities, and we will need people to come and work. There will be opportunities. So I think it will get easier. In terms of the business and the practice, that's mainly lockdown has affected that, like it's affected, all of you having to close. I'm assuming you had to close for a period of time. And
we had to close, yes.
Yeah, so in the same way. How long did you have to close for?
We closed for 3 weeks. I mean, we were essential services, so we could treat emergencies. And I have to say, again, a big shout out to SADA. I know in the UK you had problems with organize, someone taking responsibility to give direction. And at the beginning of March, thankfully, SADA took really a huge responsible kind of role in sitting down and saying, okay, we need to write, we need bodies of people, and these are the people to start to put together the protocols that we are all going to need when we come out of the 3-week, the hard lockdown, and to advise us on how we could safely open under different levels, bits of our practices, that it was safe for us and our patients felt safe coming to see us. And I have to say, in dentistry in South Africa, I think that we've really come out of it fairly positively, as much as we can, and definitely one of the better professions, as a result of really good planning at the beginning. We had a really great group that we all sat together, and there was sort of solidarity, not for the first time, but solidarity when it was needed. And again, what a great topic, what a great theme, because we chose the theme of the conference this year, Stronger Together, before we knew there was going to be a pandemic. And it was so appropriate. This wasn't like a spur of that. We chose it, and thank you for mentioning. That day, I think it was, what was it, November the 2nd, just over a year ago, where we managed to not narrowly beat England 32-12 in the World Cup final. I thought I had to mention that.
Well, yeah.
But anyway, that was it. The one thing that I would say, and then we can maybe close, because I think we're done. We've got some more questions. How are you coping with infection control with COVID? Do you have air sterilization?
We personally don't in our practice. We know some people who do. We were very fortunate because we've got fairly new buildings, and when we built the buildings we had ventilation built in, fresh air ventilation. So this allows us the required number of air changes every hour, which means that we're able to reduce our fallow time to a reasonable amount. So we don't have air sterilizers. We have to have special masks, which are fit tested, which are called FFP2 or FFP3 masks. Some people wear these hoods, which are breathing, and that are used for kind of hazardous material suits. But really, we have to wear special masks. We have to clean the surgery in a particular way, and there's set protocols. But within those, it's funny how you get used to it. For the first month or two, it seemed like a real problem to do this, but now you adjust how you work. You make sure rather than doing lots of short appointments, you do longer appointments, and you try and do more within them, because you know about fallow time at the end of every appointment, and you just change how you work and the order in which you do things to allow time for the air to kind of change or the air to settle afterwards. So we haven't invested as such in air purifiers, although I know many people who have.
Yeah, I agree with you. Right. I mean, that was brilliant. I think we've done all the questions. You've done a great job. Thank you so much for that, Martin. And don't stress about this evening. These things happen. So, we have some prizes to give, actually, which is the good news from last night. And you're going to be choosing 3 lucky attendees.
Excellent.
Which they will get emailed, and they will only know who they are tomorrow. So what I need you to do is choose 3 numbers between 1 and 340.
I'm going to choose 127.
Yeah.
I'm going to choose 264. I'm going to choose 85.
Okay. I won't ask you how you got to those numbers, because that might take us some time. But yeah, thank you so much for that. And I'd like to just add one thing about the Stronger Together, the team effort, that I think sometimes we as the dentists, at the end kind of delivery point, seemingly get a lot of the credit, for a lot of things that happen behind in laboratories, in part of the team that patients maybe sometimes don't even get to see. And I can say that I consistently, every time when I sit with a patient towards the end or at the end, I mention and thank every single person that was involved in their treatment. And I mention them to the patient. So the patient is aware that this didn't happen just because of me. It happened because of this whole amazing team that works around me, that their journey was as pleasant and as successful as it was. And I think that's super important, to give credit, to lab technicians, to the people that our patients are totally unaware of. because as we've said the whole evening, that without these people, it doesn't happen.
You're right. I completely agree. Hence, you know,
Yeah.
there's that. What I love, the slide where I'm one little part of that bit. Yes, I get to get some of the glory, but I'm only a small part of the wheel. And really, it really, you know, thank you for the opportunity to speak to the South African Dental Association. Thank you for those of you who've stayed this late. But it's been a real pleasure to kind of talk and to go through.
That's very kind. So the last thing I have for this evening, and I'll see you again on Thursday. We have Ricardo Mantrini from Spear Academy. I don't know if you know Ricardo, coming to speak to us. He's an amazing guy. But I have the winners of last night's lucky draw. And so there was a 5,000 Rand prize from Straumann, which goes to Lambert Krief. And the Ividen Sunstar Oral Care Hamper goes to Alpesh Kanji. So Marilise will be in contact with both those lucky winners. And tomorrow night, we'll let you know who number 127, 264, and number 84 was. But anyway, thank you, Martin.
Thank you very much.
Enjoy
Martin.
the rest of the evening. And thank you so much for that. Thank you to everyone who logged on. Sorry for the inconvenience at the beginning, but that was a great presentation. And yeah, we look forward to seeing everyone again. Tomorrow night, we have a lecture, a beautiful lecture on cone beam. And then again on Thursday with Ricardo Mantrini from the Spear Academy in Seattle. He's another great presenter and definitely not worth missing it, and particularly that you run a chance of getting a nice prize. So thank you, Martin. Thank you to everyone. Thank you to SADA, and have a great evening.
And thank you again,
Cheers,
Martin.
Martin. All right, no problem.
Okay.
All righty. Good night. Good night.
Dr. Martin. Thank you, Dr. Mark. I'm going to close the meeting now.
Okay. Thank you, Marilise. Bye-bye.
Well, bye-bye.
Cheers, Martin. Bye-bye.